Hello, hello, everyone. Good afternoon. Buenas tardes.
Mhm.
As we get started, please feel free to share how you're feeling today by selecting. Let me get this poll up, and here we are. By selecting the number that best represents how you feel right now, you can also drop in the chat where you're joining us from. We'll begin in just a couple of minutes to give others time to join. Okay, I see that chat box is coming in on fire. We have people from everywhere. We have Ohio, Virginia, California. Sorry if I don't get to read them all. There's a couple. Texas, Nevada, Virginia, also Michigan. Thank you all for being here. Nice. California, PR, Puerto Rico en la casa. Woohoo! New York, Seattle. Wow, nice. I love Seattle. And our chat, how are you feeling today? ¿Cómo te sientes hoy? We have the most votes. Let me see. We have the most votes. We are feeling calm, doing okay. Tranquilo, tranquila, todo muy bien. That's good. Good, good, good. So, having that in mind, Dr. Evans, you know how the mood is. You can use that at your advantage. I will be ending the poll now. Thank you all who participated. Good afternoon again. Welcome to today's webinar, Building Trust and Reducing Barriers, Implementing Culturally and Linguistically Responsive Behavioral Health Services for Latino Communities, led by Dr. Michelle Evans. Next slide, please. To hear today's presentation in Spanish, please go to the Interpretation tab on your Zoom panel and click Spanish. You can also mute the English speaker's voice, clicking Mute Original Audio. Para escuchar la presentación de hoy en español, vaya a la pestaña de interpretación en su panel de Zoom y haga clic en español. También puede silenciar la voz del presentador en inglés haciendo clic en silenciar audio original. Next slide, please. Thank you. Now we will be going over a few housekeeping items. Today's event is being recorded and will be made available publicly through our website and other media channels. For today's webinar, all participants will be muted. If you would like to speak or ask a question live, you may raise your hand and you will be given access to unmute your microphone. Please make sure your computer speakers are turned on and up to hear today's presentation. If you're having technical issues, please send a message to the Hispanic Latino Behavioral Health Center of Excellence on the chat box. If you have a question for our presenter, we ask that you use the chat. Simply type your question and hit send. We can address questions to the presenter at the appropriate time during today's presentation or at the conclusion. We will be sharing a copy of today's presentation in PDF format through the chat box. I think my colleague Paola has already sent it over. She's awesome. We will also make a copy of today's presentation available to be downloaded through our website. You can find it under the name of today's event. A recording of today's webinar will be posted also in our YouTube channel. Next slide, please. Please complete the evaluation. This evaluation is very, very important. It will help us know more about your opinion and thoughts about this presentation and what other topics and training you would like to be offered. A link of the evaluation will be shared through the chat box. You can also scan the QR code at the end of the presentation to complete it. You will receive a certificate of attendance by email approximately 1 week from today. Please remember to check your junk folder. Okay, our mission. Our mission is to advance and support the sustainability of behavioral health by promoting community-driven, culturally grounded, and person-centered prevention, treatment, multiple pathways of recovery, and recovery support for Hispanic and Latino communities, as to strive to accomplish, no worries, this mission through the development and dissemination of culturally informed evidence-based behavioral health information, providing training and technical assistance, and supporting the growth and expansion of the behavioral health workforce that serves Latino communities. At this time, I will turn it over to Dr. Michelle Evans, who will introduce herself and begin the presentation. We hope you enjoyed today's webinar. Welcome, Dr. Evans. Thank you so much.
Thank you so much for having me. I always appreciate speaking with everybody who's here, and also I appreciate the Hispanic Latino Center of Excellence only because they have such wonderful training such as this, and so I'm really, really excited to be here. So before we start, I noted how everybody is feeling today, and I'm glad the majority of us are calm. And so if you haven't had the opportunity yet, just to take a deep breath and release it. Because I know attending a training like this is an opportunity just to spend a moment with ourselves, to improve ourselves, learn something, and really help ourselves just become better at whatever we are doing. I'm just so encouraged to see that so many of you are from across the country. I'm here in Chicago, Illinois. I saw there's a couple of you from Chicago as well, in the same area. And so I'm really excited that we can come together from all over, and just be able to share and talk about what we're doing to improve accessibility and services that we're offering to this population. And so a little bit about me. And so I am Dr. Michelle Evans. I'm a licensed clinical social worker. And so I've been working with individuals with mental illness, substance abuse, and sexual abuse issues for decades now. It starts to get, and I don't know where you are in your career, but it's always one of those things when more of your clients come in and you're like, wait, I've been in practice longer than you've been alive. That's when you're like, oh, I've been around a long, long time, which is fantastic. And every single day I continue to learn. Currently, I'm the Chief Executive Officer of Elgin Mental Health Center, which is a state forensic psychiatric hospital here in Elgin, Illinois. And I also work as I have a little private practice where I work with individuals with sexual addictions, drug addictions, and especially working with the Hispanic Latino community. I also teach, and so I love to give these presentations just to connect. I know it is an enriching experience for all of us to share ideas, and in the work that we do, that is how we continue to grow. And so hopefully today I can share some things that I have learned along the way, and also, as mentioned, please use the chat. I'm watching it right here, and feel free to share. And one of the things I love to do during webinars is use that chat because we can see where each other are from and also ideas. One of the things that COVID brought us when we started doing so many more of these webinars is the opportunity to talk during class. Meaning, if there's something I'm talking about where you're like, oh, I have this idea, I wish I want to share it with others, we can throw that into the chat because people then can see other ideas. And so please make sure to use that. And I've had webinars which were great in terms of sharing other ideas, especially as I continue to kind of talk about the topic and give some points. So today we're going to be talking about the cultural, linguistic, and social factors that influence health and behavioral health outcomes among Latino communities. At the end of the day, the one thing I love about the work that we do in especially mental health and behavioral health is that we do treatment that works. One of the things that I always say is if a client isn't successful, it's not the client's fault. It is the treatment's fault. I continue to dream of a world where we have identified the evidence-based treatments that get our clients the help that we need. I don't know if you have ever sat in a place where you're like, I'm looking at this client and I know they need something. There's something maybe I could share or an exercise we could do or just a different way of doing things that would help this client more, but I just don't know what it is. And that's why all of us go to these sort of webinars. That's why we go to ongoing training, just constantly throughout your lifetime. We never stop learning. And it's because we know that for every single client, there is a unique intervention that can get them where they need to go. That idea is what gets me up every single morning. Because I know that sometimes there are some complex cases that I'm working with. Again, I work in a forensic psychiatric hospital, as an administrator, and then I'm working with this very, very serious addictions. And when I have clients that are struggling to engage or struggling to even follow the interventions that maybe we've been agreed on, I'm identifying going, you know what, there's something I missed in my assessment. There is a point that's preventing the client from fully engaging in this treatment. that evidence tells me could be super effective. And so those factors, those things that get in the way are actually what we're addressing today. So that and I'm hoping that as you listen to this webinar, you have a case in mind. Identify someone that you've been struggling with. And let's look at it in terms of micro assessment to look at, okay, we have a wonderful evidence-based treatment. Are there cultural, linguistic, or social factors that are actually preventing this individual from being successful that maybe I could address? Because again, when we have factors that increase risk, the whole goal is to bring in a mitigating factor that can help them be successful. All right, so hopefully I've set us up here in terms of where we're going. So here we go. What we're going to do today, my commitment to you, is we're going to describe key cultural, linguistic, and social factors that influence, evidence-based, influence health and behavioral health outcomes among Latino communities. So that's what we're doing. We're going to talk about common barriers to care, including language access challenges, stigma, and relocation-related stressors. We know that often humans, in just the process of change, it's incredibly stressful. And so we're going to talk about those things. We're going to apply culturally responsive communication strategies to strengthen trust, engagement, and therapeutic relationships with Latino individuals and families. One of the things now I've taught in many, many different programs, social work programs especially, and sometimes I don't think we focus enough on communication. We can have all of the great evidence-based ideas in the world in our mind, but it's how we communicate it that matters. I often say I don't get to decide the what. I don't get to decide, what addiction, mental health diagnosis my clients come to me for, but I do get to decide the how. How is it going to be delivered? How are the services going to be delivered? And what's my role? And a lot of my role is communication. What is said both verbally and non-verbally, and that does change how my clients interact. And then we're going to develop practical steps to adapt programs, outreach, and clinical practices to better meet the needs of Latino populations. And I never do a webinar unless we have something we're going to walk out with. In other words, what's our next steps? All right, so let's start at the beginning. What is behavioral health? So I know some of you are probably very, very new. Some students I see in the chat, thank you so much for coming. Like I said, we attend, if you're a student, you will have webinars. Oh, if I counted how many webinars I had in my life, whew. And so thank you for coming. But wherever you are in your career, let's make sure we have a good definition. That's part of our communication, even with clients. So let's make sure we understand what we're talking about. So behavioral health is expressed differently across cultures. In Latino communities, symptoms may emerge as physical pain, silence, or avoidance due to stigma and cultural norms. I'm sure many of you are now thinking about that client who came into your office and was just silent. And oh, for a therapist, that is one of the most frustrating things, to feel like you're like interviewing the person. How was your day? Fine. What did you do? Nothing. And just one question after another where you're like, man, this is a really just bad interview. And so flipping that and going, okay, their silence is still communication. It might not be verbal. However, silence is just as much communication as being hyperverbal, where they're talking, 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 and just not letting you in for even a minute to respond. How much we communicate is communication. And so respecting that silence of them coming in and then just grounding in that moment and going, hey, you know what? I've recognized that I've been asking you some questions, but I'm sensing that there's something preventing you from giving me a little bit more. Or is this all that you want to share today? Stopping, returning to the present moment, and having that conversation with the client is sometimes what can open up, meaning, an individual of just, I have nothing. Maybe I'm so overwhelmed, I don't even know what to say, or I don't know why you're asking me all these questions. So it's an opportunity to clarify. And so this is where we start with behavioral health, recognizing that verbal, nonverbal, physical pain, avoidance, what we do and not do are also part of behavioral health expression. So let's do a couple of basics. Anxiety. And so I know many of you, if you're working with this population, it's a little bit different than nervios, and so anxiety can come, that word can be defined by many different things. And so, for our purposes, it's characterized by excessive worry, restlessness, and hyperarousal, just meaning, just you're aware of everything. Latino community stressors often amplify anxiety symptoms, especially as we look at changes and things that are happening, just in communities. Depression may present as persistent sadness, hopelessness, withdrawal, or fatigue. And I like that withdrawal because often depression does impact motivation. If I don't feel like, doing anything, I might not make it to treatment, which is a symptom unto itself and one we should expect. In Latino populations, somatic complaints like headaches or stomach pain are often more commonly reported. And so, for those of you that are bilingual, if you think about the language and how we express depression, often that tells us a lot about where the feelings are. And so, just noting that body language and asking, well, how are you feeling today? Watching where hands go, you know, this is a common, oh, I feel sad. And it's like, okay, can you tell me more about how you're feeling that sadness in your chest area maybe today? And so just watching that body language can tell you a lot more about what's happening and where the sadness might be, especially if we don't have the specific words to share. And so panic attacks, ataque de pánico is the word in Spanish, are sudden surges of intense fear with physical symptoms such as chest pain and dizziness. So you can have, according to the DSM-5, you can have, panic disorder, which is separate from a panic attack. You can have panic attacks as a part of anxiety or panic attacks as a part of panic disorder. And so make sure you consult with your DSM-5 to be able to properly diagnose if you are a diagnoser. Panic attacks are sudden surges, like I mentioned, of that intense fear, and misinterpretation of these attacks as a medical issue can delay access to mental health care or medical care. And so certainly when people are telling me about just having a panic attack, I talk to them about breathing, chest pain, and we're talking about, okay, what happened immediately before the panic attack to determine, was this an emotional thing that happened, or are we looking at something more seriously? Always make sure to refer the individual to their physician to rule out any issues. Grief in border regions is often linked to ambiguous loss. And let's just say grief in any region is linked to ambiguous loss, including losses related to family separation without closure. In the world we live in today, where more and more families are living across the country, wonderfully, technology has given us that ability where we can work in a different area than we live. We can have family across the country and still interact with them via video. However, in that, there's also those regular routines of life that we are losing when we separate. When we live across the country from each other, there are certain things you can't just stop by someone's house for a cup of coffee. And in that, because the relationship changes, there are losses related to this separation, whether it's complete separation or temporary or time-based separation. This grief can be chronic and deeply destabilizing, especially as we're looking at anniversaries of possibly when people have passed, when we're looking at different seasons of the year when we typically are around family more, such as holidays and things like that. Often we can see some of these symptoms increase. And so our goal is always to be aware of that, especially how the culture may contribute to defining what grief is and what loss is. I know I've worked with a lot of individuals who have transitioned, moved to different countries, moved to different parts of the country, and often they minimize because they're like, well, everybody in my family, we've all moved, we're separate, we live in different parts. And so, but when we start really opening it up and the individual becomes more comfortable, we start to recognize that they've lost the quality of relationship. There's things that are happening in their life they don't share with people that are far away, but I don't want them to worry. And so they end up having a life that's kind of separate and different from what they share, only because, well, my loved one lives so far away. I don't want them to worry. But then they're not necessarily sharing and being open with what's going on. And yes, I appreciate in the chat just the comment, grieving the cultural traditions. When you're not with your family, there's certain traditions you have, memories from childhood that they just don't hit the same, as I'll say, they're just different. And that happens as we go through life and different people from our life change, different people pass, it just feels different. And so this can come up, and especially when we're being successful, maybe in treatment, and then all of a sudden we step back. Our important thing is to look and going, okay, what factor has changed so that we can adjust our treatment intervention to be able to address those factors and make it successful. All right, so let's talk a little bit. So speaking about grief, let's look a little bit at that situational versus clinical distress. So it's so important to distinguish between distress from situational hardships, such as poverty, which is huge, or recently moving, or having other situations, a family member with an illness, versus clinical mental health conditions. Both require support, but the interventions are going to be different. When I'm working with an individual with chronic depression, for instance, this individual may have had previous history of mental health treatment. Additionally, they may have had medication on or off. They might feel some sort of way about it, but they also might have additional skills because of treatment they've been in. But we also know with depression, if it is a mental health condition, this is something that's going to continue relatively steadily despite situational changes. They get a brand new job, we still see that they're excited about. We still see some depression there. Versus situational hardships, we can see kind of a start and end to it. Might be over a long period of time. I was working with an individual not too long ago, a young teenage boy, about 16, and having a lot of behavioral issues. And I asked him well, when did this change? When do you feel that people started getting on you, as he said about his behavior? And he's like, well, everything was fine before, until my uncle died, which had been years before, like when he was about 8 years old. But from that moment, we had a marker going, okay, before he was 8, life was easy. After his uncle passed, we've had this time due to many different changes in the family. His uncle was a stabilizing individual, and once his uncle passed, there was just time after time where he wasn't getting many of his emotional needs met because of changes in the family dynamic. And so now we see a 16-year-old who's in the middle where it just keeps, one thing just keeps building onto the other, where he's like, at this point he's labeled, bad kid kind of thing, where it's like, well, no, we've missed a factor way back, this destabilizing factor of that uncle passing, and we've never actually addressed his grief regarding his uncle's passing and the grief that the family continues to have, with the uncle not being there. And the family never learned to stabilize themselves. They just keep, it's just always a little bit too late, and they're not supporting each other and not talking, and so you can have situational hardships that can happen over many years. So one of the things that I always say, culture is not something we add on. Culture is actually the center of all of the work we do. When we think about culture, it's what gives meaning to our experiences of psychological distress, health, and healing. Culture, I always like to define it as my beliefs, norms, and values. When we think about what your values are, maybe you have a value of helping others. That's why a lot of us end up in this profession. Maybe you have a value of independence. I know I have a value of responsibility. Now, it works that I work in a lot of, with a lot of individuals who are in the criminal justice system. That responsibility value works really well in my place in the world. And that's why I don't work with preschoolers. Because my value, and it's just something that's super important to me, but it aligns with the work that I've chosen. But that's a part of my culture. And I can go back in terms of things that happened when I was a child that built that up to tell me, hey, this is important in life, in balance. And so as we're looking at our values, the norms can be how we celebrate what we're doing. It can be how we get up in the morning. I know I always have very active discussions whenever I ask anyone how they store their butter. I know it's super weird. And there are two factions. There are people that store their butter only in the fridge, and people that store their butter only outside of the fridge. And the two of them, that's an argument that I never knew existed in this world. But that's a norm, and I'm glad to see there's some people in the chat that do both. I'm glad to see there are balanced people in this world. But if you ever have a treatment group, ask them that. Discussion takes off, let me tell you. And neither one can understand. That's a whole nother question, though. And so, yes, values, norms, and beliefs are those three things that how I define culture. And so we have norms, we have values, and then beliefs. Now, us therapist type people, we love to work with beliefs. These are the things, what I think about the world. All right. And so my culture tells me how things are, especially as we talk about what do I believe about power? Who should have power? When should they have power? How should they show that they have power? There's a belief in there, very firm for most people. And how I believe that will tell me generally if I get along with certain people or not. I know if you've ever had a client where they come in and maybe they're talking, and this is we're all behavioral health people here. I can say this, where you're just like, oh man, everything they think, I think the opposite. Of course, as a therapist, I back up, and it is so not about me. However, every once in a while, it's like, oh, I gotta open up here, because this particular individual, everything's completely different. And that feeling, that spidey sense right there, that's culture, right there. Because it gives meaning to our experiences. And we're going to talk a little bit about that in a minute. Also, it forms whether I seek help or not. We all have beliefs about who should when, who, what, where, when we should seek help from. And it also, when I should participate in care. It also helps me understand services and institutions. You want a big cultural value? We can say seeing the doctor on a regular basis for preventative care. I'm sure all of you know people who are like, nope, you go to the doctor, that's when they find something wrong with you. You know, Other half of the people go, oh no, I go regularly. If there's something, I want to treat it early. Those are very different beliefs. And if we back up, usually we can see other people and other beliefs in that individual's family or growing up where something happened. Someone who had a diagnosis that, was very difficult to hear. Or other people were like, yeah, because of preventative care, we were able to stop, what was happening. And so it also helps us express, explain, and communicate our distress. And it changes how we perceive and prioritize our symptoms. All right. So a little bit about cultural humility. So basically, we all know humility is about, I don't know everything. So providers that serve Hispanic and Latino communities recognize the importance of building relationships. Important aspects to take into consideration while building these relationships include context, the communities where our clients are located. All of us are all over the nation, and I have spoken all over the nation. And yes, what we think and how we build relationships is different depending on where you are. Power imbalances, worldviews, meeting the needs of individuals whose voices are not heard, acknowledging and owning one's limitation, and openness and interest in the client's cultural identities. And so that impacts how we build relationships. So as you think about your hard to engage clients, think about these particular things. And are you reflecting back to them acceptance of wherever they are? Do you actually, come on, behavioral health provider to behavioral health provider, do you actually accept it? Because sometimes we do communicate a lot of what we feel, maybe in a very quiet area. Maybe we don't say it, but facial muscles sometimes are hard to hide. And so, really looking, going, do I actually accept my client for what they're expressing to me? And how am I doing that? So, I mentioned a little bit ago, culture is behaviors, values, and norms. And so, let's look at some of the common values of the Hispanic Latino culture. First of all, we have confianza, which is that trust. I know I've worked with a lot of individuals that they kind of sense me out. Typically, my married last name is Evans, and so they do not believe that I am Latino when they first meet me. And so, talking a little bit about our shared history, my background and my family, usually helps within appropriate, lengths. Usually helps. And in the Chicagoland area, I live in an area where there's a large Latino population. And so usually talking a little bit about, yep, this is where, this is where I'm from, this is, where I stay. Usually that helps build trust almost instantly because, and let's connect it to culture, instantly they understand that there's elements of themselves they're not going to have to explain to me. Because that's a big thing is when someone feels that you don't understand their culture, in a treatment session, in any kind of behavioral health, intervention, it is a lot of work to explain your culture to someone else. And so when they develop that trust of, okay, I think you have some knowledge about what I value, and what I believe, that trust, or that you will accept it, that trust goes a long way. Personalismo. Now, a minute ago, I mentioned just talking to people about, yeah, this is kind of where I'm from. This is my background. As a Latina person, that personalismo is that personal relationship that is valued. And sometimes if we don't share that, if we don't have that, hey, how are you? Yep, I'm your treatment provider. I'm not perfect. I'm here to help you and share what I have. And I really want to hear your ideas, for how we can work together. And developing that personal relationship. It's still professional. There are still healthy boundaries there, but that relationship and just that being personal, as I'll define it, is really important. Respeto, obviously, the majority of the world wants to be respected, but it's very, very important, especially as we're looking at cultural norms, how those norms are expressed, who speaks first, how do we refer to people? If I have a room, if I have a family of people, who do I address first? That all that respect is built in the micro behaviors that we have. It's so, so small when you go to speak to somebody, especially as the treatment provider. I have power by who I speak to first. That's me sharing and going, okay, this person is the person I want to hear from. And so we have to be very careful of how we deliver that power, and to make sure that it follows the family's norms, especially in initial sessions where I'm here to understand and work with them. And so if I start going, well, we need to hear more about the kid, I'm going to have the kid go first. That can be overriding parents, and it can lead to them feeling disrespected. And then espiritualidad, spiritual. Spirituality, I always define, I look very heavily, it can be religion, it can be our beliefs about why we are here on earth, but it can also be our values, and so understanding someone's connection to why they're here, what their motivation for living is very important, because all of that changes how and why we're going to do things. I've worked in treatment where that is mandated, for a lot of people over my career. And often when I can connect our interventions to what they value is when we actually see change. So a little bit about the origin of illness. So if you go back to COVID, I hate to bring it up, all of us were in this space where there were some of us that believed that COVID was developed by somebody else, by them, to try to get us, to try to control people. That was a belief. Those individuals, when we saw what they believed, was causing illness, we saw their behavior, to correspond to that. So if I believe that COVID was made up by the government, I think way back when we saw people like actually they had to wear a mask, so it'd be like actual like netting, something that obviously wasn't for infection control, because they're like, no, this is a made up illness. Other people believe that, okay, yeah, there are germs that can be on anything. I don't know if you remember people sanitizing their groceries, because it's like, I don't know where it is. And I believe this could infect me, that infections are happening. And so I'm going to take every step possible to make sure I'm eliminating bacteria. And then we're people kind of in the middle going, okay, well, I'm going to try to be a healthy person, increase my vitamins, so to be as healthy as possible. And then they were kind of in the middle of the other two. So we saw many people coming from different stances on what COVID was, and their behaviors corresponded to those. And so as we look at this is also a very cultural thing about what is the belief about where illness comes from, especially as we talk about behavioral health disorders: personalistic, naturalistic, and biomedical. And I'm going to tell you about each of these. So in a personalistic system of beliefs, individual may believe their illness was caused by the intervention of a divine being. In other words, this sounds really complicated. Bad luck. In other words, you know what? This thing that I have, if I got this big bad illness, depression, whatever it is, it's because I wasn't a good person. Someone in my family wasn't a good person. And so, yep, that's just what happens. And so recovery then entails the use of ritual. Now, especially as we talk about a diagnosis like obsessive compulsive disorder, sometimes the use of ritual Everything in balance is the rule here. Ritual can become obsessive, but they can also be prayer. Okay, you know what? We're praying daily that, my brother will improve. And these, and all three of these are equally fantastic. So as we think about it, it might be different than your way of thinking, but there are some people have been doing it for hundreds of years because it works. And so I want you to think about that for all three of these things, because there's going to be one of them at least that you're like, I don't know. But remember, all three of these people have been doing for hundreds of years with success. People do what works. And so that's incredibly important to remember, especially as we're working people that have ideas worse than us, or worse than us, different than us. That's what I meant. So as we look at recovery entails the use of ritual. It might be prayer, symbolism. Many people wear crosses, light candles, things like that, often by natural or spiritual healers. Many of us take maybe vitamins. We're like, okay, well, guess what? Took my vitamins, got all my steps today, and it's gonna then kind of overlaps with the next one. But it's okay, this is how I stay. If I'm perfectly healthy today, but as long as I do these things, eat my protein, I'll be good. And and it turns into, it's in addition to, we believe it's healthy, but also there's a ritual in that these are the things I do to keep myself healthy, to ward off illnesses. And when we become ill, we're like, well, I've done everything I needed to do, helpful or not. We feel like it's a personal thing. I shouldn't be sick. Why am I the only one in my family that's sick? None of y'all do anything. you know that's this. And so the next one is naturalistic. This is harmony and balance is sought in maintaining health and well-being. When there's not balance, illness results. Naturalistic treatments increase metabolic health through diet, exercise, energy balancing treatments, humoral, Ayurvedic, and vitalism. So we think like yoga. We think the diets. Okay, I need to maintain my diet to make sure all of my macros are in line, or I have to make sure I get my steps. And so we're seeking wellness through doing these things. So you can see how having a client who might be more personalistic, where this is something internal, in terms of, I need my rituals, to keep myself healthy versus, I need to treat this with diet. They might actually overlap a little bit, or they might be completely separate. But it's understanding, because again, our goal is to identify the factors influencing our clients. And then, of course, we have biomedicine. Especially, again, I'm in northern US. We tend to like this one. The body's a machine, it's Western medicine, focuses on theory, knowledge, and the empirical research of illness to advance treatment options. So here we're looking at medications to balance, if I'm not getting the nutrients I need, there's always a specialized vitamin just for me, but also there's treatment, surgeries, all sorts of things that can help me, function. And so, especially as we're looking at behavioral health, we see the same things in terms of mental health, and behaviors. And so, just thinking when your client walks in, if, identify kind of where you are now. And again, we can mix these. We can be my biomedicine. I'm going to see my doctor. I'm going to have the test done, but I'm also going to make sure my diet is balanced. We can have a lot of mixes, but knowing where your client is important to address what they're looking for, and what they believe is going to be helpful. All cultures have their own combination of these beliefs, which influence their practices. Theories of health and illness help clients understand their experience of illness and is the foundation of the basis of their understanding. So I'm going to pause here because I want you to imagine somebody with a very significant illness. And with that, if they're sitting in a place where they're like, it's personalistic, I have a major illness, life-threatening illness, and it's because of things I did when I was younger. That's going to be a whole different conversation and intervention from someone that goes, you know what? I need to go see the doctor, get some labs done, see what treatment recommendations, might have to have surgery. You know, those two people, depending on how you're approaching them, that's going to be very, very different. And if you're a biomedicine person who's talking, and working with someone who's more personalistic, they're going to think you're crazy. In other words, they're like, well, you want me to get like just have stuff cut off, but here I'm telling you that I need to spend more time in prayer. I need to do some things, get myself right with the people around me, with my family members to really deal with this, to kind of have this cleansing. And so it's really important that we can adapt to be able to best meet the needs of our clients. because that's actually what they're going to continue to do. Clients, you can give your recommendations, but if it doesn't support how they think, again, culture, their values, beliefs, or norms, if it's not supporting of that, they're not going to continue when they leave the room, you know. All right, common barriers to care. So, as we know, and this is true in every community, but especially with the Latino community, many community members hesitate to seek behavioral health services because of stigma, fears, and mistrust of institution. Understanding these dynamics is essential to provide culturally responsive care. Often when people come in, the first thing I ask is if they've seen a therapist and if it went well or not well. Because if they're like, yeah, I can't stand therapists, I know where I'm starting, and that's okay. I can acknowledge, yeah, I totally understand. It's a little weird to come in here and share your life with someone you don't even know. Um, and that can open up a lot. So often there are a lot of barriers as we talk about insurance coverage, cost of treatment, lack of Spanish speaking providers are huge barriers. And these are structural issues. And I can talk as a CEO of a psych hospital, I can speak all day as to organizations and how we can help, overcome some of these things. But at the end of the day, we are all working within the same structure, which is difficult. Others avoid, they might have insurance, but they avoid just because they don't trust the institution. What are you documenting? Where is it going? And this can create delays in treatment. The most important thing here to do here is to talk about what you are doing, how you are actually, where their information is going, and make sure they don't have questions. Of course, this has been developed by historical ongoing discrimination that's contributed to the mistrust of healthcare and government. And there's all sorts of things that have happened. And if you've worked with the Latino population long enough, we've seen it ourselves of where they go and ask for help and end up in a place that isn't helpful for them. And so, but so as you kind of read my slide, I'm going to tell you a funny story. I have this group of Spanish speaking individuals where every week we talk about highs and lows, something good that happened, something bad that happened. And they will tell me, yeah, this week my truck broke down. We didn't work all week because it was raining. My kid's sick. My mom went to the hospital, pero todo bien. And we always end with that, but everything's great, and I'm like, but you sound like a bad country song. All of this stuff happened, pero todo bien. But everything's good, which is we'll just keep going, and it's that échale ganas, just keep pushing through. And often, and I've had to with this group, so we've dissected that, pero todo bien. Yeah, we have taken it apart, and I'm like, what exactly do you mean? And how does that continue things that you're not addressing? The fact that, yeah, your mom went to the hospital and you were so worried, but you don't want to talk about that in this group. And so you're just going to tell me todo bien so that maybe we don't talk about it. We just keep moving on. And that's a part of our culture, and when we look at the individuals and we look at our history, the history of Latino populations, we can see that just pushing through with many of the things that have happened. Of course, lack of linguistically appropriate services. There's miscommunication, misdiagnosis. I've had so many clients come in and they thought one thing was happening, and I even thought I had one individual who was trembling with it when he came in. He was court mandated to see me because he thought I was going to give him a shot to make him stop thinking how he thought. But he came in anyway because he had to. And so, but we see that there was just no communication about what a therapist does. And this stigma, he would have never come in by himself. The stigma leads to internalized shame, secrecy, and avoidance of care. And so individuals, Latino adults with depression, are less likely to seek treatment because, again, therapy is para los locos. Therapy is for weak people. And once they actually come in, we can see just how we can change that. You know. And thank you in the chat. Thank you for sharing. So every time we have a risk factor or barrier, we look for the protective factors. This is our super, okay, for those of you in behavioral health, this is our super strength. Finding the protective factors, there's always a strength. There's always something we can work with. Often the protective factor is family. Listening to their stories, bringing family in and talking about, and just about every family you are never the first person to have messed up or to need help. Let's talk about that. And trying to get families, I found that usually once I bring families together, they're very understanding, but finding how we communicate that. Sometimes we communicate things through story, talking about things. And this is why I love, hearing my clients and telling the story of their week because I recognize the narratives they're building. And so everything, when we're in a group session, if you do groups, that is storytelling. This was my week. And you can hear from inside the story just their beliefs about themselves and the worlds they work in. And that's where, as a therapist, we're going through that middle and going, okay, here's the story about your week and what you're experiencing. And right there, we can see this particular protective factor. That's what's actually holding you up, so that hecho de ganas, it can delay treatment, but it can also keep us going when things are really hard. And especially treatment is hard. And so that, hey, we're gonna make it. That is incredibly powerful. And so we know, as we talk about the interconnectedness of barriers, we know that some of our communities have compounded stigma. There's concerns just in sharing information. Is this going to harm me in the future? And these barriers are not experienced in isolation. Gender, race, poverty, and status create unique vulnerabilities. To reduce the barriers, we need systemic change, grassroots strategies, meaning, and I got to tell you, as a CEO of a psych hospital, even where I am there, I need individuals who are working with the individuals to be able to tell me, how do we need to change? What do we need to do to help the individuals that are coming in our doors today? Because our populations are constantly changing and growing. And so that's incredibly important. All right. Well, we're going to jump into some strategies because I know our time is flying by and I don't want to leave you unless we have actual strategies that we can use. So I know I've been going super quick today. There's just a lot of good stuff. All right. So let's talk a little bit about communication. Trauma-informed communication recognizes trauma history in every interaction. I want to add for everyone. Individuals that are currently watching this webinar have experienced trauma. How I communicate and talk about trauma can harm people. Even if I don't know you, I've never met you, how I present myself, how I present this information has to be done in a trauma-informed way because even in this, it can be triggering, or I can position, in talking about trauma, if I say things, oh, it's only, people that do this, people that do that, but make generalizations, it can harm. And so as we think about that, every interaction we have has to be trauma informed in recognizing, universal care, that everybody may have gone through trauma. Now, trauma, let's define it a little bit. Trauma isn't just going through something hard. We go through lots of different hard things. Trauma is the experience, is the emotional experience afterwards, And so think about it. Let's say I hit a knife against my hand. It might not cut. I still hit my hand with a knife, but perhaps there's no mark, or perhaps it's a little mark, where I'm like, oh, it's bleeding a little bit. Or I could hit my hand with a knife and I could cut pretty severely. And that's a trauma, And so, but it's going to be a different level of harm depending on who I am, depending on my skin texture, depending on the knife. All of these things are going to change, the actual harm done. And so, but the trauma is the harm, not that it happened. And so we have to focus on safety, trust, and empowerment. Avoid practices that re-traumatize. Listen carefully before offering advice. If someone shares something that's similar to an experience you have had, oh my goodness, put little red lights there of stop, stop, stop. Because often when we hear somebody that has had a similar experience to us, we want to tell them what we did. And that just completely blows out of the water everything we just talked about, just in terms of where they're coming from, how they view what the harm. And so if you tell me something that happened to you, I'm like, oh, that happened to me. Here's what I did. It really helped. You should do this, you know, that instantly the individual who had the traumatizing experience, it's like, okay, when I'm talking about myself, I'm not thinking about you anymore because I'm thinking about me. And so that's where it's back up, listen, And then we work with them to identify what it means for them and what intervention might be helpful. Your experience can inform you. However, it informs you just like this webinar, classes you've had. It's just another piece of information that we can use in identifying what's best for our client. So, so yes, listen carefully. And generally, I don't like to offer advice. I like to keep advice out of here because my advice, I've only lived this one life. I only know the life I've lived. And often going back to the client and going, okay, let's talk about what would work best for you. You know, use choice, collaboration in those conversations with transparency and clarity, and respect silence and pauses. Empower the client's voice and agency. I've worked with so many individuals where therapy didn't work for them. And as they were talking, they were telling me this didn't happen. They're like, yeah, I went to a therapist. They just told me what to do, but none of it worked for me. It's like, aha, right there. The therapist told me what to do and it didn't work for me. Tells me that you didn't have a really good experience. Some of these things, again, we always communicate with both our nonverbals and our verbals, maintaining gentle eye contact, open posture, honor their preferred language, use interpreters as needed, respecting cultural norms, slowing down, using a calm, grounding voice. Your voice is everything. Work on it. Talk to your friends about it. Do you think my voice is calm? That could be a dangerous question. Be ready to hear what they have to say. And so, but that's so, so important. And yes, we will give you access to the slides. So sorry if I moved a little fast there. Also acknowledge emotions, not just behaviors. It's easy to acknowledge this is what this is what I see is happening. Always go back to, and how did that feel? You know, Helping to understand what emotions are happening because sometimes people do things and they're disconnected from that emotion. And that's super important, that we identify and then connecting that with coping strategy. All right. So as we talk about trauma, so again, today, in our conversations, we've talked a lot about what we're looking at, how individuals are coming in, what actually is culture and how people are perceiving that. And so then now we're talking about how to actually, respond and using communication skills. So if we put aside, and it's not totally aside, but just to right here on this side of the desk, our behavioral health skills, and we look at how do I communicate? What's happening with my face? What is happening with my eyebrows? If I'm really thinking hard, this is my thinking hard face and it looks angry. I try not to think too too hard too often. Or I raise the eyebrows because especially as we're talking about responding to somebody, responding in a crisis, they need this kind of communication assessing immediate safety, the level of risk, using those grounding tools in a calm way and providing that connection, you know, even if it's for 2 seconds of how are you feeling right now? Let me get you to someone that can help. Even if that's all you're doing, that how you present yourself can be grounding. And so when you feel overwhelmed, I saw today in our how we're feeling emotionally, some of us are feeling a little overwhelmed. You're certainly not alone. Take the deep breath and ground ourselves so that we can continue on. It's very important to stay regulated, to model that calmness, and recognize that our goal is to empower client decisions. Those crisis moments can be opportunities for connection and healing, and providers need those skills and self-care practices. That's so important. All right. And some of these things, I know if you've been in behavioral health a while, are just really great reminders. Focus on strengths. We talked about those protective factors, not the deficits. Deficits are what we're treating. Protective factors and strengths are how we're healing, how we're bringing healing to the intervention. Again, make sure it's rooted in that culture, identity, and belonging. Make sure the individual, somebody feels like they belong, even in your therapeutic session when they feel like they have a voice, when they feel they have agency. They can say, this is what I'd like or not like. In the Latino population, healing is a collective, and this I got to tell you, it's for most families. When we change one person, if we adjust one person to be slightly healthier, the rest of the system changes. Sometimes it's subtle, sometimes it's a lot more, but healing is always done on a collective basis. because and when we find that somebody is healed or improves, we find that often the people around them, family and friends around them in their community, they have to either change or otherwise they're not fitting as well. And that can be another thing that we have to work with in our intervention to sustain the healing. A lot of people, are not successful, once they actually return and aren't in treatment that supports it. So that is incredibly important. So I wanted to bring up kind of the differences between trauma-informed care and healing-centered engagement. So trauma-informed care recognizes harm and individual focus and safety and trust. That healing-centered engagement focuses on restoring wholeness. And now remember, earlier in this presentation, we gave you the personalistic, biomedicine, and naturalistic ways of seeing illness. And so now let's connect it with that focusing on restoring wholeness. Now we can understand what that wholeness looks like for the client. Additionally, in that healing-centered engagement, which includes trauma, it's healing-centered, not we're not focusing on that trauma anymore, but we're focusing on that healing, which includes the trauma. We have that collective and community focus and providing them with agency, which isn't like the organization. Agency is my ability to make my own decisions, hope, and possibility. And so that's what we're moving toward. All right. And so I know you will see a lot of these slides. You have access to the slides. And so kind of to finish up here, just a couple of different therapy techniques that you can research. So as we look at narrative therapy techniques, those are very good for story. So one of my hobbies is storytelling. There's actually organizations that do it because of this particular thing of helping the individual share their narrative and story. Also start looking for those culturally grounded rituals, which doesn't mean we're like, doing something that, maybe you're unfamiliar with. Go back to your client and what are some of the routines? Sometimes switching ritual for routine can be helpful in helping your client understand what you're looking for. What are some of the routines that you have within your culture that help you feel balanced? And then developing those community healing spaces, which could be a formal, this is my community healing space, or it could be their family. You know what? I had an individual the other day, that's talking about, okay, you know what? When I'm at home, I go and I sit after work, my mom, she makes me food, she makes me coffee, and we sit there and we talk about our days. That's the community healing space. It's not a formal one, but within his culture, he's like, this is what I do every single day, have the café con leche and talk to my mom about my day. And that provides him with a lot of emotional support. So I'm going to pause here. So hopefully you've gotten some new strategies, and just a new way of thinking this. Are there any particular questions or things that come up, or any comments in the chat just about what you've learned? I'd love to see what you've learned today.
Yes, we do have questions in our Q&A box, Dr. Evans. First of all, thank you so much for that valuable presentation. The way you provided this information, I really loved it. Very innovative, very new, very up to date. So thank you for that. And we have also a lot of comments that have been also saying thank you, and it has been an amazing presentation. So moving
Mhm.
forward, go to questions. Have you observe differences in the therapeutic relationship with Hispanic versus non-Hispanic clients? And how do you balance that with maintaining clear professional boundaries?
Mhm. Certainly. I think often the difference between every single person is culture. And so our goal, it's not so much about one population against the other or different. It's looking and going based on this particular culture, especially because we currently live in a world where, people might be first generation, second generation, third generation, and being able to understand a little bit enough about their particular culture, especially if that's not your culture and understanding what that means for the individual. And so I think the what we're doing doesn't change based on the culture, because we as the behavioral health provider, we're still identifying where are they. Now, of course, I see some trends, just like we talked about the different values that the Latino population may be different. And so I know there might be some commonalities, but every single person is different. What I always say is every single intervention is cross-cultural. And so no matter if I'm talking about somebody who seems like me, who looks like me, or someone who's very, very different.
Thank you so much. I hope that answered your question.
Mhm.
Another question is, based on your experience, what are one or two practical ways providers can begin rebuilding trust with Latino clients who have had negative or traumatic experiences with healthcare or government systems?
Mhm. I think in this, it's always use of self. We are an individual that some of our advocacy work is often offering our own understanding and having that relationship. Again, we remember personalismo, that value is incredibly important. And so when we offer, that personalismo of being able to connect, often that's where we rebuild that trust, that confianza. And so use of self, I think is the best way to do it.
Thank you so much for that answer. We have a couple more questions while we have time. Please fill out the form. This form will help us keep providing these types of webinars in the near future. So next question would be, what strategies have you found most effective for addressing stigma and myth about mental health with Latino families, especially when family dynamics can both support and hinder care?
Yes. I think it's making sure that the client and the family know everything you're doing. I'm very, very open with the materials that I give. I always give them in Spanish and English, and I make sure they get a copy. I always explain it in depth. I think it's so often that, especially with paperwork, we're like, okay, just sign at the bottom, and then we take it, and they never see it again, but they don't fully understand. And so when you see, I kind of like put my hands up, going, "Hey, you see what's in my hands? I'm not doing anything. Everything I do, you understand it." I think that is centering because that can build trust. And also, I teach my clients how to advocate. When I hear that they're not receiving services they need in other areas, teaching them how to advocate within that area in an appropriate way, how to call, how to talk to individuals, how to talk to the manager, to say, hey, I'm not getting the help I need. I think teaching advocacy to our clients teaches them that you're on their side to get services, and again, all of it's done in an appropriate way. But when they see you're their advocate, often that personalismo is developed where they're like, okay, I can trust her, and then they will call you for everything. If ever they need a referral, anything like that, they reach out, which is a wonderful thing.
Great answer. And one more last question so that they have time to fill out the evaluation form and
Mhm.
also the poll if they have used the interpreter or not. What advice would you give providers who are early in their careers about practicing cultural humility and recognizing their own limitations when serving Latino communities?
Mhm. I think for all of us, and this is if you have been in this in here for 2 days, you've been in this field for 2 days or 20 years, is to recognize that humility part of I don't know everything. I've been working with Latino population for over 20 years. I'm Latina myself, and I don't know everything because everyone has had a different experience. And so to maintain just that humility, knowing my clients are coming in to help me understand their lives as they've lived it. And I will never be an expert. I always tell everybody, you are the one, world galactic expert of you and your life. I've read a lot of books and talked to a lot of people. I will see how I can, my job is to see how I can help contribute to your life, but you really know what you need. And so the agency always remains with the client. They know what they need, but we have to trust them, and in that process, they feel it.
Thank you so much. I feel very warm with that
Mhm.
information, valuable information, many things in the chat. Thank you all for
Mhm.
being here. We don't have any more time for questions, but please don't hesitate to come back to our proximally more events near the future. Thank you so much,
Mhm.
Dr. Evans, for this collaboration. Thank you all for being here. Have a good day.